Hello, Dr. Ernst, and welcome to our Group 3 presentation on the ethics of telemedicine, presented by Alexandra Barker, Sasabil Jera, Beth Kappenberger, and Josephina Kundu. This presentation will cover the following: an introduction of telemedicine, discussion of any precedent legal cases or legislation, discussing of any precedent medical journal articles, discussion of at least 2 opposing views of telemedicine, discuss how telemedicine impacts healthcare delivery and impacts PA practice of medicine, how telemedicine impacts patients, any recommendations or best practices on how healthcare providers can resolve the ethical dilemma, and real-life examples of telemedicine. Telehealth is the delivery of healthcare services and information remotely through digital communication technologies, such as video calls and phone calls. Telehealth has rapidly gained traction in modern healthcare, especially during the COVID-19 pandemic, which accelerated its adoption as a safe, efficient way to provide care while maintaining social distancing. This technology continues to expand as healthcare systems seek to improve access and reduce costs, benefiting patients and providers alike. Telehealth offers a convenient option for patients in remote or underserved areas or those with mobility challenges. However, despite its growing use, telemedicine is still a relatively new addition to the healthcare landscape, and there may be certain areas of medicine where telehealth is not appropriate. For instance, while a surgical consultation might be feasible via telemedicine, conducting the actual surgical procedure is clearly not. Similarly, in an emergency room visit, how can a healthcare provider assess a potential broken arm without a physical exam or x-rays? These issues lead to important ethical considerations. What are the laws surrounding telehealth? When and where is telemedicine most appropriate? When are teleappointments unequivocally inappropriate? There are also the concerns that telemedicine could make providers more lazy, perhaps leading to suboptimal patient care. Additionally, conversations need to be held surrounding patient privacy and informed consent with telehealth. As we move forward into a more technology-dependent era, telehealth will undoubtedly have a place within our healthcare systems. To ensure its effective integration, the questions above must be carefully evaluated. Ultimately, telehealth will play a vital role in future healthcare practice, requiring evaluation of its ethical and practical boundaries.
So prior to the COVID-19 pandemic in 2020, Section 1834M of the Social Security Act outlined some regulations regarding telehealth practice. This included how to reimburse for telehealth services, what technology had to be used, and restrictions on where telehealth can be conducted. At this time, telehealth services could only be provided in designated rural areas at approved sites. These sites included physicians' offices, hospitals, rural health clinics, federally qualified health centers, and community mental health centers. Physicians also had to be licensed in that state that their patients lived in and in which they practiced in. Then in March 2020, after the COVID-19 pandemic was declared a public health emergency, the CARES Act was passed, and this allowed telehealth to become much more flexible. The geographic restrictions were lifted, so telehealth no longer had to be conducted at an approved site, and patients could use telehealth at the comfort of their own home. Physicians could provide telehealth services to patients in other states that they were not licensed in. The public health emergency designation ended in April of 2022, so telehealth regulations went back to the states to decide. Many states went back to pre-pandemic regulations, including California, where patients cannot receive telehealth services from physicians outside of the state. Currently, there is an active lawsuit, Sean McBride versus Hawkins, that is challenging the telehealth restrictions in place in California. Dr. McBride is a radiation oncologist in New York who treats rare and unique cases of cancer in patients across the country. He frequently consults with patients over telehealth services and has patients in California who could no longer utilize his care now. Shelley Horowitz, a native of California and the other plaintiff in this case, regularly consulted her hemophilia specialist in Oregon for her care over telehealth services. Suddenly, her providers stopped answering her calls, and she was told they can no longer provide her care over telehealth due to the restrictions in California. The defense state that these restrictions violate the Dormant Clause, which prevents states from passing laws that discriminate against interstate commerce or place undue burden on it, and the Privileges and Immunities Clause, which guarantees citizens of each state are treated equally to citizens of other states. The defense also states that this is a violation of the First Amendment, in which patients and providers have the right to share and receive information from each other. Also, these telehealth restrictions limit access to healthcare and specialists who may not be available in certain areas. Telehealth practices allow for greater access to specialist care and improved continuity of care. As this case is still ongoing, we do not know yet the outcome of this case. Hopefully, the court rules in favor of the plaintiffs and other states follow suit to lift their telehealth restrictions. As of 2024, a new bill was introduced in the House of Representatives that would permanently extend the flexibilities given to telehealth practices during the pandemic. The Telehealth Modernization Act of 2024 is currently awaiting further action in the House. Granting this bill into law would further expand access to care to people across the country through flexible telehealth services. Many medical journals and associations have come out with policies and standards of care concerning telehealth practices. In 1999, the World Health Association came out with a statement that set standards for the use of telehealth. This included having a face-to-face encounter first to establish a patient-provider relationship prior to using telehealth services. Physicians assume all responsibility for the patient's health when using telehealth and must use a professional judgment on whether or not the care they provide during telehealth is optimal. In this statement, they spoke about the benefits of telehealth, including increased access to specialists, expedition of specialist services due to the ability to send medical information over long distances, ability for providers to consult with each other and with patients, ability of surgeons to guide less experienced surgeons through complex procedures, and greater access to medical education and research, especially for those in remote areas. However, the statement also warned about using telehealth solely to cut costs. And then in 2014 and in 2016, the American Medical Association released statements about the ethical responsibilities of providers when using telehealth, stating providers must continue to provide competent care, have respect for patient privacy, and follow best practice guidelines. In 2019, the AMA amended to the statement further responsibility to ensure quality care, including ensuring patient information is correct, that protocols are in place to prevent unauthorized access to health information, ensuring authentication of patients' identity, and recognizing technology limitations and the limitations of themselves. A study was conducted by the American Medical Association that reviewed opinions of physicians on telehealth in 2016, 2019, and 2022. This study found that physicians were influenced to use telehealth services more due to the prospect of improving clinical outcomes, work efficiency, and reducing stress and burnout in physicians. The study also found that 93% of physicians in 2022 feel that telemedicine is an advantage in patient care. And the study found that physicians using virtual visits increased from 14% in 2016 to 80% in 2022. This goes to show that telehealth is a tool of medicine that is here to stay. However, its applications must ensure that high-quality care is provided.
I'm going to be discussing how ethical issues impact patients. So first, we have an increased risk of misdiagnosis, and this could be due to varying standards and coverage. Obviously, both in-person and virtual interactions can result in misdiagnosis, but within telemedicine, there aren't detailed legal statutory clauses that are standardized. This can lead to a decrease in quality of care and poorer health outcomes. Within telemedicine, physical examination is limited. You mostly have to rely on visuals. We had a patient last week who developed a rash on her knee after immunotherapy, and we did a telemedicine to reassess. You could clearly see her rash had resolved, but telemedicine wouldn't be able to address a patient who complains of something more severe like pain in the area. Patients may not have access to private housing or personal headphones, which gives concern for lack of privacy. Also, not everyone wants their provider to be able to visualize their living conditions. This may make it more difficult for a patient to share sensitive information, such as with regards to HIV or behavioral health or personal information. Patients may have barriers to access to technology or internet. Not all patients are comfortable using mobile devices or tablets. This particular study that I cite discusses that at the individual level, patient barriers included older age, limited English proficiency, and limited digital literacy. The author recommends taking universal digital health literacy precautions, which can be achieved by assuming that unless proven otherwise, patients do not know how to interact with technology. I'm also going to be discussing opposing views on telemedicine. The first view discussed that by bridging geographical barriers and expanding access to the underserved, we can address health disparities and improve outcomes in vulnerable populations. Telemedicine has expanded beyond primary care and has reached many different medical specialties and geographical regions. This enables comprehensive, personalized care no matter the patient's need or location. There are challenges to healthcare accessibility, such as transportation barriers or high healthcare costs. Offering telemedicine to patients not only with transportation barriers but those who live in rural areas mitigates health disparities. And while telemedicine has the potential to be cost-effective, it depends on the distribution of cost, efficacy with regards to patient satisfaction, and successful outcomes and indirect savings. Regardless, telemedicine reduces travel expenses for patients, especially if they live in rural areas. The author discusses that the full potential of telemedicine cannot be harnessed without addressing challenges such as equitable access and protecting both privacy and data security. He then concludes that telemedicine does mitigate financial, sociocultural, and infrastructural barriers, though the healthcare system must concurrently work together to address issues and needs that cater to both providers and patients alike. On the other hand, there is an increased potential for security breach. Patients' personal medical information may be available on different devices. However, this is more of an operational than an ethical issue. Another important consideration is that one size may not fit all. Everyone has differences in access to technology. Some patients may feel comfortable with messaging while others may not have access to a computer or smartphone. These differences could exacerbate equity issues, and the telemedicine should be user-sensitive. The author goes on to discuss that there is mixed evidence on whether telemedicine is efficient or improves outcomes. He encourages the new generation of providers who are more tech-savvy to take the lead in evaluating the effectiveness of telemedicine. Providers are taught about the importance of the relationship with their patient to foster a mutual trust. For this reason, telemedicine should only be used if the practitioner has a pre-existing relationship with the patient, and it should only be used to supplement live visits. Understanding and addressing concerns about the loss of patient-provider relationship within telemedicine ensures improved access and quality of care.
We will now discuss the areas where telehealth positively impacts healthcare delivery and how telehealth impacts PA practice of medicine. We will discuss the accessibility and equity, patient privacy, quality of care, patient choice, and scope of PA practice in regards to telehealth. Accessibility and equity. Telehealth is a powerful tool for increasing healthcare access, especially in rural and underserved areas. It allows patients who might struggle to reach traditional care settings to receive support remotely. For PAs, this means that they can bridge these gaps in care for patients who might face mobility challenges or live far away from clinics. However, telehealth also raises concern about equity, as all patients may not have reliable internet or the digital skills needed to access telehealth. PAs must be aware of these disparities and look for alternative solutions to reach everyone effectively, advocating for support systems that address these barriers to ensure inclusive healthcare. Patient privacy. Patient confidentiality is the foundation of trust in healthcare, and telehealth introduces unique challenges in protecting patient privacy. PAs must be vigilant in following HIPAA protocols and cybersecurity measures to secure patient data. During virtual visits, there is a heightened risk of unauthorized access, so it is essential to communicate these security practices to patients, reassuring them that their information is safe. By prioritizing digital security, PAs can maintain the same level of confidentiality as in-person visits, building patient trust and fostering a sense of security in the telehealth environment. Quality of care. One key consideration in telehealth is ensuring that the quality of virtual care matches that of in-person visits. Telehealth is particularly useful for chronic care management, follow-up appointments, and prescription refills, allowing PAs to provide effective care remotely. However, telehealth is not suitable for all scenarios, such as surgical procedures where hands-on skills are necessary. To maintain high standards, PAs need to stay informed on effective virtual examination techniques and adapt to patient needs. By making careful decisions about what is appropriate for telehealth, PAs can continue to deliver high quality and consistent care remotely. Patient choice. Telehealth offers patients more choice, but it is essential that they fully understand both the advantages and limitations of telehealth appointments. Informed consent becomes a key part of a PA's role, ensuring patients are aware of what telehealth can or cannot do. Patients need to feel empowered in choosing their care method, and PAs can facilitate this by clearly explaining telehealth processes and setting realistic expectations. By encouraging patients to make informed decisions, PAs promote patient autonomy, allowing them to take an active role in their own healthcare journey. Scope of practice. Telehealth adds complexity to a PA's scope of practice, particularly when it comes to state regulations and licensure laws. PAs must be aware of the legal boundaries they operate within, especially when providing care across state lines. Practicing within these boundaries minimizes liability and insurance compliance within healthcare laws. Staying up to date on telehealth policies and consulting with supervisors or legal advisors when necessary is crucial. This approach helps PAs manage liability risks effectively while maintaining ethical standards in their telehealth practice.
The appropriate use of telemedicine. As previously mentioned, advancements in telecommunications have created significant opportunities to improve access to care, quality of care, and satisfaction for both patients and healthcare providers. Telemedicine is intended to enhance rather than replace conventional healthcare system by supporting specific limited functions. There are, however, appropriate and inappropriate situations for utilizing telehealth services. An example of inappropriate utilization includes physical examinations or hands-on encounters, life-threatening situations, critical procedures, complex cases, and cases where reliable technology is lacking. Appropriate utilizations of telehealth services are often seen in primary care consultations. This would offer the patient convenient access to primary care and allow for the provider to manage preventative care services and follow-ups for the patient. Telehealth can also be utilized in dermatology. The provider would be able to evaluate the patient and conduct the session remotely by reviewing images or labs with the patient in the session. Outpatient psychiatry services also utilize telemedicine services as they facilitate access to mental health, support therapy sessions, and medication management without the need for the patient to come in person. General best practices of telemedicine. This includes the following. Fidelity. Providers must disclose any financial or personal interests that could influence their decision related to commercial health services. Competence. Providers have an obligation to use efficient, reliable technology when delivering healthcare services. Transparency and informed consent. Providers must clearly explain telehealth services and obtain electronic informed consent from patients. Privacy and confidentiality. Providers are responsible for protecting patient privacy, verifying that affiliated websites have adequate privacy policies, informing patients of any limitations, and disclosing the credentials of all involved healthcare professionals. Continuity of care. Providers must ensure ongoing care and discuss privacy protocols for future follow-ups directly with patients. Recommendations. Integrating a learning system approach. Researchers conducted a meta-analysis study and collected qualitative data in 4 countries. This includes Sri Lanka, the United States, Colombia, and Argentina. Within this study, researchers noticed a lack of perspective from healthcare practitioners included within ethical guidelines of telemedicine services. Integrating a learning system approach will require healthcare practitioners and ethical guideline developers to work together to understand different contexts of clinical practice, innovative models of care delivery, emerging data, and evidence-based outcomes. This would help develop a clear set of priorities and guidelines for ethical conduct of telemedicine. Why is this approach beneficial? Implementing strategies would leverage clinical care and experiences and data to continually improve knowledge and practices. This would also tackle disparities in telehealth access and usage to ensure equitable healthcare delivery. Lastly, this would focus on feedback from patients and providers to enhance telehealth system for better overall quality of care.
To wrap up, we wanted to discuss a few real-life examples of current telemedicine practice. These examples will show us that the future of telemedicine will require additional oversight and regulation, education of expectations for both the provider and patient alike, and also how useful and positively impactful telemedicine already is.
We kind of wanted to discuss an ongoing lawsuit between the United States Justice Department and the Federal Trade Commission. So on June 10th, 2024, the United States filed a complaint against the telehealth company Cerebral. So Cerebral is an online telehealth company which offers mental health treatment for patients with insomnia, depression, anxiety, etc. They previously were prescribing stimulant medications such as Adderall or Concerta, but they are no longer permitted to. The United States accused Cerebral of violating the Opioid Addiction Recovery Fraud Prevention Act of 2018, along with the Restore Online Shoppers Confidence Act. They were misusing patient-sensitive information and failing to keep that information private and secure. They basically had their website intentionally develop online tracking technologies which collected users' sensitive information without their consent to third parties for targeted advertisement. They also did not safeguard consumer-sensitive data from unauthorized disclosure, even though the company did claim that they had secure services, which the United States also alleged that employees of Cerebral falsely impersonated patients on online reviews and posted fake reviews praising the company, and they also did not allow for negative reviews to be posted on their website. They did not obtain informed consent prior to billing patients and did not provide a simple mechanism for patients to cancel their subscriptions. So by the time they were caught, they had obtained millions of dollars because they hindered consumers from canceling their subscriptions. They have also been required to inform customers of this lawsuit. So you can see in this attached photo at the very top, it says FTC notice and data deletion requests. And if you click on it, it says that between October 2019 and March 2023, we shared the personal information of consumers visiting our website and apps with other companies without their permission. Specifically, we shared details such as contact information, birth dates, IP addresses, and other demographic information, any intake questionnaire responses that they provided, location information, and subscription or treatment information such as appointment dates, clinical information, what insurance you had, what pharmacy you went to, this information was shared with 24 firms, including social media such as Facebook, TikTok, and Google. So the director of the FTC's Bureau of Consumer Protection does want to hold executives accountable for taking privacy and security shortcuts, along with hindering subscribers from canceling their service. And this is an example of the misuse of telemedicine, and the lawsuit against Cerebral is still continued.
Telemedicine has incredible potential, making it easier for patients to access care quickly. However, it is not always the best choice for every appointment, as we have already discussed. For example, we recently had a case in my dermatology clinic. Established patients at my clinic have the ability to schedule appointments online. They can schedule either in-person or video call appointments at their discretion. And one patient used this option to book a telehealth visit for a suspicious skin spot. During the video consultation, the doctor quickly realized it looked more like a skin cancer and informed the patient they would likely need to reschedule and come in for an in-person biopsy appointment, and also informed the patient they likely needed a second in-person visit for surgical removal. This scenario highlights a growing challenge in the expanding world of telehealth. Both patients and providers may lack clear guidance on when telemedicine is appropriate. To bridge this gap, public education will be key. Patients need to understand when in-person care is necessary or when it is unnecessary. As telemedicine continues to grow, these kind of hiccups will likely decrease, but it's clear that thoughtful scheduling is essential to optimizing patient care. I leave you with this question. What systems could my clinic implement to reduce inappropriate telemedicine visits when established patients can schedule themselves online at their own discretion?
Now let's go ahead and look at an example that displays telehealth services being utilized appropriately, ethically, while also enhancing accessibility and quality of care for patients. Sometimes setting up an appointment with your provider can be a strenuous process. Since 2020, 43% of patients have reported experiencing longer wait times for their appointments, and 17% of patients have also stated that they had to wait at least 1 to 3 months for their latest doctor's appointment. Now, when dealing with sexual and reproductive concerns, you can't afford to wait. WISP is a telehealth company based in the United States that provides primary care, sexual health services, prescription refills with discreet deliveries. This service also offers birth control medications and treatments for urinary tract infections. WISP has a legal script certification, which is a third-party accreditation service and requires all providers and partner pharmacies to be U.S. licensed and board certified. All patient health information is stored in a HIPAA-compliant manner, and payment processing is also PCI compliant. Now, the process of using WISP is very simple. First, you select the care service you are looking for and complete the question intake form. After submitting the intake form, a medical professional will carefully review and reach out to set up a follow-up appointment if necessary. This service would occur the same day via phone call or through a secure chat to ensure privacy and effective care. For anyone living in the following states: Arizona, D.C., Delaware, Kansas, Missouri, Rhode Island, Vermont, or Wyoming, are required to have a video visit in order for the clinician to provide care to remain in compliance with state prescribing laws. The provider will either send the prescription to a local pharmacy the same day, or the prescription can be shipped for free to your home in discreet packaging. If there are any questions or concerns, WISP offers a 24-hour customer service chat with the care team. WISP is also cost-effective. Now, they don't take insurance, however, individuals can use FSA or HSA cards to cover their appointments and medications. Overall, WISP provides a reliable, private, and efficient health service solution for individuals needing primary and sexual health care services without the extended wait times of traditional appointments. By offering prompt access to treatments like birth control or UTI medication, WISP meets the needs of patients in a timely manner.
Another positive application of telemedicine is in the management of mental health conditions. Telemedicine allows for better continuity of care. By increasing accessibility to mental health services, patients can contact their provider more easily and have better access to more appointments. In fact, those with serious mental health attend more appointments if they are held virtually. More appointments attended by the patient improves the patient-provider engagement and relationship, and also improves continuity of care by having regular follow-up appointments. A real-life example is at one pediatrician's office, a provider continued to manage the mental health medications of her older patients who had moved away to attend college by using telehealth visits. This allowed for the accommodation of the student and physician's schedule without being limited by location and forcing the patient to come into the office for an appointment. In this way, the patients can continue their medications and mental health follow-ups with their trusted provider without the added stress of having to travel for an office visit or having to find another provider.
We will now finally conclude our discussion on the ethics of telemedicine. Telehealth has a valuable place within our healthcare system and has been and will be a very beneficial tool for providing care to patients. We have discussed the laws, legislation, and medical journal opinions on telehealth, balanced our support for telehealth with two opposing arguments, discussed how the implement of telehealth may negatively impact patient care, discussed the positive impacts on patient care and the impacts of telemedicine on the delivery of PA care, when and where is telemedicine most appropriate, how to safely integrate telehealth into our healthcare systems, and finally, we wrapped up with a few examples of current telehealth experiences. Telehealth will continue to play a vital role in the future of healthcare practice. This brings us to the end of our Group 3 Ethics presentation on the ethics of telemedicine. Dr. Ernst, we hope you have enjoyed our presentation and learned something new. Please reach out with any follow-up questions you have in regards to telehealth. A sincere thank you from Group 3.